watching Good Day Marketplace on Fox 28.
Hey, welcome to Good Day Marketplace and happy Friday! Woo, woo, woo! The weekend is almost here. I'm Cameron Fontana filling in for Sean Ireland today. Now, we got a great show for you lined up. Today, we're getting some medical advice from two respected area health professionals. They combine their expertise to give you the best in care. Then, we're going to follow the tracks over to Robbie's Hobbies, where they're getting ready to celebrate the first ever National Lionel Train Day that's happening tomorrow. Plus, it's the last chance to win a pair of tickets to the Holiday Pops production put on by the Columbus Symphony Orchestra at the Ohio Theater. We're going to be giving those tickets away during the show. So tons of stuff lined up. But first, it's time for Marketplace Media. If only you could smell the aroma that's coming from the kitchen right now. Alisa, what are you up to?
Well, I was going to make cookies, which I am doing.
Okay. But
I was supposed to refrigerate this dough. And I forgot when I got here, so now it's kind of melted. But it still smells good. I want to eat it, but the package says do not eat. Nothing says Christmas like cookies.
Right.
Right? I mean, these look delicious, and I'm ready to eat. So I'm going to bake these cookies, these break and bakes, throughout the show. And I'm going to share a cookie with you, Cameron. At the end of the
yes.
show. What's
Share
your favorite
cookies.
cookie?
You know, I know a bunch of bakers are going to scream at me right now from home because my favorite cookie, it's not homemade. I love Oreos.
That's
but I
not
guess
cookie.
it doesn't count today, does it? Because I brought it in. They're like, it's National Cookie Day. And the first thing I thought of was like, oh, Oreos.
What does
And
the package say?
the package, this says Milk's favorite cookie.
So it is a cookie.
So it is a cookie. It's not a treat. It's not a dessert. But you said what? We'll eat 330 cookies by the end of the year?
300.
300? We're going to open it up during the show, and I'm going to get my 280 left for the rest of the season. But if you're really eating all of those cookies, you'll want to make a stop to Premier at Sawmill to work them off, right? Alisa shows us how convenient it is, even when you take the kids. Check this out. All right, welcome back in Marketplace Community. Let's go back to the kids department at Premier at Sawmill to find out more about this great club that Alisa has the scoop on. In Marketplace Medical this morning, we welcome Dr. Andrew Skasko from Elite Dental New Albany and Dr. Anoop Kanodia, a functional medicine family practice physician, to discuss how they come together to give patients comprehensive team-based treatment. Good morning, doctors.
Good morning. How are you, Cameron?
Good. So I like this because this line right here, your partners in synergy for complete health. What does that mean?
It really is about how we look at our care. Instead of just saying, okay, I'm a dentist and I'm just going to treat your oral cavity, we work together and look at what's the whole body health need. How can I look at the mouth and correlate what's happening in the mouth to the whole body? And then I can't do it on my own. I don't have the education and training like Dr. Kanodia does. We have to share our training together to collaborate for our patients and get them healthy.
Same thing here is that I know a few dental issues, but most of the stuff we didn't learn in medical school. So then the question is, well, how do I get people who have body issues to get their mouth healthy? But a lot of times their mouth issues lead to their body issues.
And you talk about achieving total health and wellness as a combined effort. How does that flow through your practice?
Well, in our office, we have a healthy mouth baseline. So it's a baseline of what it means to have a complete healthy mouth. And what we then do is correlate that to the rest of your body.
Okay.
Because you've got things like cardiovascular disease, stroke, diabetes, gastroesophageal reflux disorder, sleep disorder, breathing issues, and all these things can be seen within the mouth. But yet, I don't treat all of those conditions, so I need a partner in synergy to do this.
Now, Dr. Kanodia hit on that because acid reflux, that affects so many different things. How do you guys work together to tackle that?
For acid reflux, the way that we do that is that if I see that people are having heartburn or GERD, and if they have a traditional dentist, and they may not be looking at all the complete dental health that Dr. Skasko does, I refer them saying, are you also having effects in the mouth?
Oh.
And if they are, what's happening because of that? And do we need to take care of the mouth as part of the stomach?
And that is so much more effective, I can assume, when you're dealing with an issue, a symptom, but you have a team effort. So maybe I see you, and then would you send me back to Dr. Skasko if you find something else, and vice versa?
Absolutely, sure. That's the way we do it.
And the critical thing that for the complete health part of this is that in my office, we ask dental questions to every new patient. Most doctors don't.
That's new.
And and then if they come up positive, Dr. Skasko has developed a dental questionnaire, a further questionnaire, and if that comes up positive, we would then refer them to Dr. Skasko just for overall health, even independent of heartburn or GERD.
If people want to get information now, where can they go?
To either of our websites. Ours is NewAlbanyEliteDental.com, and then
Kanodia MD.
Welcome back in Marketplace Medical. We are here with Dr. Anoop Kanodia, functional medicine family practice physician, and Dr. Andrew Skasko of Elite Dental in New Albany. And they're discussing their team-based approach to medicine. Now, in the last segment, we talked about how you work together, but now I want to dive into a specific case. Dr. Kanodia, talk about the patient and start with the symptoms.
Yeah, she's a 45-year-old white female, just had inflammation, meaning stomach issues, fatigue, stress. So we worked on her nutrition, we worked on her sleep, but she was still inflamed. Inflammation is one of the root causes for almost all illness.
Okay.
And so she had a traditional dentist. We're like, great, but she wasn't getting optimal. So we say, well, maybe there's inflammation in your mouth. So we want to see a subspecialist, Dr. Skasko, you know, one of those awesome dentists, and then to say, is inflammation here?
Now that's the moment right there that separates your practices from other places, because you would have never thought of that had you not been like, okay, we haven't checked this yet.
Right.
Let's go to a specialist to see what happened. So once you found out from that point, where did it go from there?
I'll let you go there.
Yeah, so, and ultimately, Cameron, our goal is that all practicing clinicians, like Dr. Kanodia and I, treat patients this way, because this is the way that patients deserve to be treated.
It's a great vision.
We need to get our hands on health because our nation is getting much, much less healthy. So what we ended up doing is we were able to see her, and we really look at the big picture. And unfortunately, what happens is sometimes I have to tell people things that they might not want to hear, but that's what's going to...
But man, you're the doctor, you have to.
That's what's going to save their life.
Right.
And because this is life health we're talking about. This woman, particular woman, had a severe odontogenic infection, which is a tooth-borne infection in a previous root canal that she had that had a large, what you might consider abscess, we would call periapical granuloma, at the tip of her root.
Okay.
Not to mention the root behind there, she had a fractured crown that was completely inflamed. So all this inflammation in her mouth, and this is a severe infection that could either put her in the hospital or lead to death.
Just from the mouth.
Absolutely,
And
and
that's
people don't
that
realize this.
Yeah, and it affects the whole body. I mean, so then you found out what the cause was.
Okay.
At that point, how did you continue to work together? Because once she's done with you, you still want to check with Dr. Kanodia to make sure the rest of her body's right.
Well, then we further developed the plan because, again, as Dr. Kanodia said, we have a group of the best. And so I got her to my endodontic colleague and then on to our surgeon colleague as to how we're going to move through the process, whether we go forward with implant therapies or retreatment of what disease she had previously.
And so then, now that I say, yes, here's a cause of inflammation, both she and I are like, okay, we've got something to work on. And that if you don't know why you're sick, you can't get better.
Exactly.
And so then you're just throwing pills on pills and pills, or supplements on top of supplements on top of supplements, or if someone's stressed, but stress could be caused from the inflammation, you're seeing psychologists, psychiatrists, and no, if it could be inflammation in the mouth or other parts of the body, we should honor that and find the root cause.
And you said it, Dr. Skasko, I mean, a cavity can not just be sugar, what you eat. I mean, it could be the rest of your body. It can affect the rest of your body.
Absolutely.
So I really hope that this, spreads through the other practices, because what you're doing is phenomenal. Again, one more time, where can people get more information to find out more?
Mine is our website, Kanodia MD.
Okay.
Our phone number, 614-524-4527.
Great. Doctors, and Dr. Skasko?
NewAlbanyEliteDental.com, and it's 614-939-0400.
Perfect.
Anything we can do, we're all about helping people.
Well, thank you for joining us. One more thing, it is National Cookie Day. So before we throw it to Elisa, let's bust out the Oreos and let's see what's on social media. How about that? There we go.
Sounds
Well,
good.
first we want to say congratulations to Kenneth because he won our Holiday Pops tickets. Sounds like fun. And yes, lots of you are commenting about your favorite cookie. Steve says 7-layer cookies. And Judy says soft chocolate chunk cookies are yummy. Judy, I totally agree. Keep the comments coming. We'll share more when we come back.
Hey, welcome back to Good Day Marketplace. We are back in the kitchen with Miss Elisa. You've been working hard.
I have.
Oh
and
my
I've been
gosh.
eating a lot. I'm getting to my 300 cookies by the end of the
We
year.
got to get that goal, baby. 300.
So let's start with the comments. We asked, what's your favorite cookie? And Ronnie said, Texas chocolate chip pecan cookies. Yum.
I wonder what makes them Texas. They're big?
I don't know. Oh, maybe they're big.
Maybe, yeah.
That's a good idea. Judy said that she loves the soft chocolate chunk cookies.
I like them softer.
Soft is key. And then we have a picture. Stephanie sent in a picture, which we love photos,
my gosh.
of wreath cookies. Look at those. Are those M&Ms on there? Stephanie, that looks so good.
Tell us how
Cornflakes-
to make
What's
it.
the red part? Is that M&Ms maybe?
Stephanie, if you're watching right now,
Red
comment
Hots,
and tell us how
Red
you made
Hots
it.
and cornflakes. That looks so delicious.
I
Now,
love it.
her
Let's see what
cookies
you
look
did.
better than mine, but I did make
Yours look great.
my break and bake in my toaster oven
Yeah?
cookies. It's so much easier than putting
I
in the
like
oven.
this with the apron and everything. This is
Yes,
this
now
is so
Cameron, do you want to
cute.
try one? You have to really pull off the foil because I didn't grease
I
the
kind of
foil
like it
first.
like that because then you
It's-
get this gooey right here.
Yes, they're so
This
good.
is my favorite part. Oh man, here we go.
And I made an enormous cookie. How are my cookies? Are they really
Let me
good?
see. Oh, this
Oh,
is
it's
so
not
good.
done. we'll
This is my
we'll eat that
favorite.
on Monday.
Crunchy on the outside, gooey on the inside, just like us.
Have a good weekend.
Have a great one, everybody.